Hello, welcome to this week's video. Wound healing, medical needling, post-recovery. Tell me some tips. That's what I'm going to try and talk about. So, all right, stay tuned. We'll go straight into wound healing. So wound healing takes about 8 weeks. And when they were studying many years ago at Harvard University, they were studying salamanders' tails. They wanted to see, they're trying to figure out wound healing response, how to regenerate human tissue. And that's what I'm doing when I'm doing medical needling. I'm not treating it like gently. When I'm doing needling, I want the skin and body to be reasonably balanced and nourished, so then I can put that stress on the body and in the blood, releasing a lot of platelets, which then have the growth factors, and those growth factors are lay down new sheets. I've recently completed 2 medical needling, and I'll be going back into it in about 3 days. Today's Friday, Saturday, yeah, okay, 2 days. I'll be going back in again, and that will be my 3rd, and I'll be completing 6. So I don't want my skin to go through that 8-week healing journey. I want to piggyback off those growth factors wound response. So if I go back in 7 days, it's going to have another hit, which means I'm going to piggyback on all that wound healing, which means the body's going to lay down more and more sheets of collagen elastin. It's not my theory. The theory was put in practice at Harvard University many years ago when they were actually studying salamanders' tails, so those lizards that drop their tails, and they found the antagonists of the drop then stimulate the growth factors for the lizard to regrow back its tail. So in our skin, when I create that wound, the body has that mechanism in the skin cells, so it wakens up the healing system of the body, the human-like growth factors, and they grow back new sheets of specifically collagen elastin. And because I'm not using a laser or radio frequency, I'm not using any heat or stimulant, it's just the body's natural wound healing response, I focus on healing. So the more vitamin A and antioxidants and key peptides the skin has, it's going to rebuild itself back younger and stronger. If I went into that wound and that skin didn't have a lot of nourishment, it's not going to have a big lay down of collagen elastin. So the more nourished it is pre-treatment, the better results you will get overall. Also, the less dent it will have in your lifestyle. Supplements I always increase meta-algal oil. So I take 1 tablet twice a day. Why do I do that? It just helps me bleed better. So that's really good. I also sometimes need a little bit more support for my adrenal glands because I'm still working a lot and doing my normal output. So I take some herbs. This one's called Relaxame. There's different styles of adaptogens. So they just basically give more support for my adrenal glands. So there's more healing going on, more support. And I definitely increase a little bit of zinc and vitamin C. Zinc helps with the wound healing, and vitamin C predominantly helps with the collagen elastin. I have a little bit more of my green drink as well. So I use dry barley powder that I blend in water, and that one is all year round, but I usually go a little harder when I'm needling because it helps with the wound healing and repair. And food-wise, I always eat, I'm currently on a lifestyle of a whole food plant-based diet. So I find all that plants are very anti-inflammatory, and my digestion system has adjusted and my microbiome to that diet. So it doesn't need much change. I definitely would advise a client to focus on more veggies, more healthy seeds, and balanced meals, and hydrating between meals. It's the time that we probably want to make sure that we're giving our skin extra love. So when we're performing our skincare, we're wanting to make sure that we're helping the vitamins penetrate as well. Through the needling system, you're going to get some shedding. So I use the body oil and Dermalac to assist with that. Winter is currently in Melbourne, so when this video is being filmed, which just means this time of year our skin can do with a little bit more urea and lactic acid in the Dermalac to help take off the dead skin. And then the body oil has vitamin A, C and antioxidants, and being in a fat soluble form, it just helps the skin look a bit more glowy. It helps to stick down the dead skin when you're shedding as well post needling. So it's all about support, and I'll tailor the program for you, but a lot of people think needling is just a procedure. It's actually stimulating the body's mechanics to grow back younger and stronger. And after I perform 6, it keeps regenerating. You'll see that structural change. Exactly after the number 6, you usually see another shift in the collagen, elastin, volume, strength, lifting of the skin at about the 3-month mark, where the body is starting to really show that new scaffolding of the skin. It's kind of cool, right? So people are like, oh, everything's working better. Another comment is they say, my skincare, have they changed the formulas or something because it's absorbing better? So why would it be absorbing better? Well, great news is you've just improved your skin's ability to access the nourishment into the lower layers of the skin. So our skin being a waterproof organ, as you're using really good quality skincare, the barriers should be improving, the outer layers should be getting stronger, which means then it also makes it harder to apply things and absorb and the skin to access the good stuff. So it's keeping the bad stuff out, but the good stuff we need to help in. So that's why I'm always using treatments to help manipulate that mechanism in the skin. For example, I get very expressive in my face because I talk with my face. So I want to get my peptides to penetrate deeper. And when I'm using them, I'm not on them at the moment because I've got a different protocol. I can feel that relaxation of the muscles when I go to sleep. Everything feels really relaxed and calm. And it's actually hard to use the muscles when I use them. But when I'm not using those peptides, I can actually have a lot more expression, which is going to show on my face through the day. So it's all about penetration. When I finish my needling course, I'll up those peptides and I'll see that lovely natural Botox effect on the skin, and I'll get so much more out of my products. So what's the difference is the penetration. So the skin actually will improve the thickness, the volume. It's going to unglue those tight junctions. So it's going to help the products travel in. Yeah. While it's regenerating, it's a little bit like growing muscles. You have to break them down, then the body makes space for that muscle to grow. And the more nourished you are from the inside and outside, the more you get out of it. Cool, right? All right, so remember that medical needling is a course, and when you're doing it, what you do every day, how you eat, how you drink, how you sleep, it all affects the outcome of your response. So we want to encourage you, and that's why I'm always educating, because you'll get the most out of it when you do it the holistic way. All right, have a lovely day. We'll talk soon. Bye.